Well, there's probably over 200 million vaccines that are stored in America, Europe, Britain and Canada that you could airlift out tomorrow and you could start to solve the problem of only 2% vaccinated in low-income countries, only 5% in Africa. You know, the good news is the vaccines are there. The bad news is they're not properly distributed. And the World Health Organization is now saying that if we don't vaccinate people, we could have 5 million more deaths next year and 200 million more cases. And that's really suggesting that we're only halfway through this pandemic unless we take the action to vaccinate.
Where does this leave us in terms of the contracts? I mean, are we, in terms of the pre-ordering, I mean, are we blocking up that supply chain as well?
Yeah, what's happened is that the countries that got in at the beginning over-ordered and they're now being oversupplied. So we're in danger of wasting tens of millions of vaccines that are going to pass their expiry date and can't get out to the people that need them. And yet we know that nobody is safe around the world until everybody is vaccinated. And we need to get these vaccines out to prevent the disease mutating and coming back to hit us, even the fully vaccinated here. Just like the Delta variant came out of India, we could have variants coming out of Africa, Latin America and Asia. And so it's in all our interest to vaccinate people as quickly as possible, and particularly when we have these excess supplies. And that's after all the boosters and after the teenagers being vaccinated. We've still got this excess amount of supply. We should get it out as quickly as possible to people whose lives could be saved.
I mean, the way you phrase it seems like common sense. They are in urgent need in other parts of the world. And if we've got all of our bases covered here, why isn't more action happening now?
It's a lack of coordination. People are not getting their act together. It's a bit like COP26 in Glasgow. We're not getting agreements because people are not coming around the table and deciding to do things together. What you need is a timetable, a delivery plan. You need the richest nations with the vaccines coming together so that they can get the vaccines out to the poorest nations. The G20 is meeting this weekend, so they're the countries that have got the vaccines. They should be agreeing to have a task force to get the vaccines out, airlift them, use the militaries, start to save lives instead of seeing lives being lost.
How confident are you that that could happen?
I think that countries are starting to realise that it's not enough to say we're going to give donations next year or a few this year and a bit more next year. We've got to have a month-by-month plan. And I'm hoping that the G20 tomorrow, under the Italian chairmanship, will agree that they're going to get this timetable in place and get the delivery plan. And I keep saying to people, it's in everybody's interest that this happens, because if people are not vaccinated in Africa, it means the disease will spread from there. We've got to stop it in our own interest.
In terms of the global vaccination rates, I mean, they're still looking pretty poor by the end of this year, 12 months on from the start of the vaccination programme, aren't they?
Well, it's 70% vaccination in the West, 2% in low-income countries, 5% in Africa. You know, only 1 in every 10 health workers in Africa have been vaccinated, so 90% are not yet vaccinated, and they're risking their lives to save lives, and we haven't managed to get the vaccines to them. We really have to move quickly and urgently, because today I think we'll pass the figure for 5 million deaths as a result of COVID. And it would be criminal, really, if another 5 million deaths have to happen because we haven't got vaccines that we have to the people who need them. And I think everybody in this country will say, look, if we've got the boosters and we've got children vaccinated, we should get the rest of these vaccines that are left over out to the people who need them.
Gordon Brown, good to talk to you. Thank you.